Hi, Miss.
Hi, Belen. Good afternoon.
Good afternoon, Miss.
How are you? How was your day yesterday?
Oh, horrible, Miss. I went to my home at 8 o'clock.
Oh, but everything is fine?
Yes, I finally had another rotation for Monday.
Oh, that's good. So when are you gonna start? This Monday?
Yes, on Monday.
And what about holidays? Are you gonna work that days?
No, I don't think so. Actually, the doctors got to rest too, so
Mhm.
they give us free.
Oh, that's good then.
Yes.
Okay, Belen, let's wait a minute and we're gonna start, okay?
Okay.
Hey, Ale, good afternoon.
Good afternoon, Miss. Hi, Belen. How are you?
Fine, very fine, thank you. So it's hot today, but it was raining just a few minutes ago. How about Cochabamba, ladies? How is the weather?
It's cloudy, it's like now.
Okay. Did you heard about the crash?
The plane?
Yeah, the
Yeah.
plane crash. Oh my God. There were no no hurt people or yes?
There's one dead.
Oh my God, I didn't know that.
Yes, the plane went to the house of this woman and she's dead because of that. The pilots are good and that thing, but I think that, well, my boyfriend is a pilot, so he knows about that. And it was because the pilots were afraid of moving a little bit the plane. So they stopped taking the control of the plane and they jump, but they don't have to do that. To do that.
Oh my God. I I read that they they were throwing away the fuel before they jumped. So I don't know, but I thought that they had the control, but now that you tell me,
No, because when you are planning, it's you have to make sure and talk with the tower because the tower is gonna indicate you where you're gonna where you can. I don't know how to say aterrizar, but
to
land to
to land,
land.
yeah.
Yes, to land. So the most probable thing that he will do, that he deberían haberlo hecho, I don't know how to say it, was to
They
talk,
should be.
they should do, was to talk with the tower and say that they're having problems and where they can land, but they didn't do that. They just got scared and jumped out the plane.
Oh my
And
God.
yes, no, it was terrible. And they're gonna have a
Yeah.
process that I don't know.
And do you know if they are gonna pay for the disaster?
It's really probable. I think that yes, because it's their fault.
Yeah. Well, such an accident. How
Yes.
about poor pilots? I don't know what they are going to do. And poor people. Imagine you are, I don't know, lunch, maybe with your family. You're having lunch with your family, and then suddenly a plane crash into your house. Wow. Okay. Let's talk about another thing. Oh no. Okay, let's start. Lily is not gonna make it, but I don't know what is going on with Vanya. I hope she could make it. Okay. We're gonna talk about today about examinations. I know you know, and maybe you are so fresh in your memory these things, but we're gonna remember, okay? I want you to participate this time. Please tell me if you can add something or if you don't do something, okay? Belen, can you read this part, please?
Miss, I can see the the presentation. I see your documents.
Oh my God. I'm so sorry. Maybe I'm sharing another thing. Okay, I will do it again. Yes. Okay. Now you can see?
Yes, now yes. Okay. Physical examination. Examining a patient. When examining a patient, you should 1. Introduce yourself if necessary. Good morning, I'm Dr. Mason. 2. Brief the patient on what he or she should expect in a clear and simple way. Do you know what we were going to do this morning? What we are going to do today is I'm going to examine your so I can find out what's causing this. What we do is what happens is that I will ask you to, are you ready? Okay.
Thank you. So this is such an introduction, right? You can start saying something to your patients. I don't know if you have a specifically introduction and you can share with me, maybe. Or this is the way you usually talk with your patients?
I think it's fine, Miss. We have a lot of ways we can introduce ourselves, but this one is a really good one.
Okay. And what about vocabulary? Ale, I don't know if you have any doubt or you want to add something.
No, miss, it's okay. We do the same things.
Okay. Any question? About vocabulary? Or we are good here?
I think it's good, Miss.
Thank you, Belen. Let's continue. Ale, can you read 3 and 4, please?
Yes, miss. 3. Instruct the patient in a clear but polite manner. 4. Show sensitivity to the patient's needs and respond to discomfort, reassuring if appropriate. This might feel a little bit of discomfort. This might a little, but I'll be quick. Tell me if it hurts. Let me know if it's sore. It will be over very quickly. It won't be take long. You are doing very well.
Okay, thank you, Ale. And Vania, hello, Vania. Can you read 5 and 6, please? Uh-oh. Vania? Well, I think she's not here. Or she's occupied, maybe. Okay, we have 5. Talk the patient through the procedure. I'm just going to...
Ir a recogerlos y era en pleno centro.
I'm sorry.
No, sorry, Miss. It was my sister just gave me an audio. Sorry.
Okay, don't worry. Okay, we were talking about this part. Talk the patient through the procedure. I'm just going to make something. Maybe you're explaining to the patient. First, will do this and then I will do that, right? And now I'm going to proceed with this thing. You're explaining to the patient. You will feel like you will be nauseous maybe when you take the pill. When it's over, I will call to your family. That's that's it, all over. We are finished here. Okay, this is a way to explain to your patients. And 6, share your findings with the patient. Well, I'm fairly certain you've got and you explain the disease or what you find or you found. One possibly is it could be what we call, and you can tell the diagnose. I haven't found anything to suggest any problems. Okay, these are some manners to explain to your patients. I don't know if you have any questions here, especially about vocabulary. And if you want to add something, maybe any phrase that you usually use to explain to your patients, bring it, okay?
In number 4,
Mhm.
what is reassuring?
Reassuring. Okay, it's like when your patient is anxious and nervous and you have to make them calm. Okay, it's like tranquilizar, reassuring.
Thank you, Miss.
No problem. Any other word or phrase you don't understand?
I think it's fine, Miss.
Okay, what about you, Ale? Thank you, Belen.
It's fine, Miss.
Perfect. Let's continue then. And we're gonna continue giving instructions. When examining a patient, polite forms are often used for the initial instruction. Could you bend forward as far as you can? If you could cross your arms in front of your chest. What I like to do is examine your standing up. After that, the direct instructions may be used. Stand with your feet together, lie perfectly still, and to soften an instruction, can you just turn to the side again? Could you just lie on the couch? Okay, these are some instructions you usually use. Is there any other that you can add here? Maybe for common procedures you usually work with?
Maybe can you discover your arm?
Okay, that's a good one. For example, in odontology, I say, can you rinse your mouth with this collutor, please? Okay, and then the patient drink that and just rinse their mouth. Okay, that's one instruction. Another one, or maybe some word that you don't understand.
I don't understand the phrase, could you bend forward as far as you can?
Okay, that's a good one. How about you, Ale? Can you add some other instructions?
No, miss, I have the same doubt, the same balance doubt.
Okay. Belen, what you said, it was a doubt?
Yes, please.
So sorry. I was flying around. Okay, can you repeat it, please?
Okay, it's can you bend forward as far as you can?
Can you bend? Where are we?
It's the first one.
Could you bend forward as far as you can? Okay. We're gonna find this word. I forgot to. Okay, could you bend as forward as far as you can? It's like when you say to contract your fingers, maybe. We're gonna use this example. And you have to bend. It's like a doblar, okay? And maybe the patient has some trouble doing this, and you will see that. Do you understand? Belen?
Mm, yes, maybe with another example, Miss. I don't know why.
Okay, maybe the patient had some accident with with his knee, okay, and he's gonna he cannot walk, but you will say, could you bend forward as far as you can, and the patient will try to move his knee, okay, as much as he can. Do you understand now?
Yes, Miss. Yes, yes.
Okay. What about you, Ale?
Yes, miss.
Okay. In Spanish, it will be something like, puedes doblar tu rodilla, o digamos en este caso, ¿no? Lo más lejos que puedas, ¿no? Hasta donde pueda, digamos. Sería la traducción aproximada. ¿Ok? Any other doubt? We are good here?
Yes, Miss.
Okay. Here we're gonna have some expressions that maybe we will use, okay? And we have a list of verbs like bend down, right? We know that bend is like doblar, bend down, it's going to the front side and down, right? Just like here. Then we have breathe in and breathe out. Maybe in which cases we use this instruction? Can you tell me?
Maybe when we are examining the lungs.
Okay, yeah, that's a good example because you said almost like inhale or exhale, right? Can you breathe in and breathe out to examine the lungs? Good, Ale. And then we have close your eyes. In my case, to use the halogen light, okay? I have one blue light to work in odontology. That's why I can say, close your eyes, please. Then we have curl up. Do you, I don't know, but maybe you use this instruction in some examination?
I
Can you
didn't
give me an
see.
example, maybe?
I didn't see that.
Okay, this curl up, maybe when, well, maybe with a physiotherapist, right? When a patient has they can ask to curl up patient, okay? And of course, we can tell our patient, can you do this and can you do that? Explaining the patient what to do, just like here. Then we have follow my fingertip with your eyes. In which kind of examination you do that, guys?
Ophthalmologist exams
Okay,
or for neurological exams too.
okay, perfect. Thank you, Belén.
Miss,
Yeah,
in that case, we are examining the campimetria. How could I say that?
I think it's campimetry. What is that? Can you explain to me? Or describe to us?
It could say how much the patient can see
Okay,
around.
okay, thank you. That's campimetry.
Thanks,
You can
Miss.
say in English. Okay, no worries. Then we have keep your knee straight, right? Maybe for some fractures or something like that. I don't know. You can give me more examples.
To keep your knee straight,
Yeah,
it's we do that for seeing el signo de la segue.
la
Eh,
segue.
la segue, right. It's for
La
seeing
segue, la segue sign then.
la segue sign is for lumbar pain.
Oh, explain to me, Belén, I'm sorry.
Okay, I think that my internet is a little bit bad, but
Yeah, we have a little bit delay.
yeah,
Sorry.
yes. Okay, like it's in the picture, we do that. We raise the leg a little bit, like actually at least the patients say that it hurts. So when it hurts, even when you're raising the leg that angle, then we can say it's positive. So it means that maybe the patient is having like an hernia, or maybe the pain is increased when we do that, or that thing.
Okay, Belen, I'm so sorry. I couldn't listen the last part. Oh, you're back. Okay, hello, ladies, again. I'm so sorry, Belen. I don't know what happened. It was my internet then. Can you see my screen?
No, Miss. Yes. No.
Okay. Can you listen to me?
Yes.
Yes, miss.
Thank Okay, Belen, I'm so sorry. You were saying that this sign makes you know maybe that the patient can have an hernia or something like that?
Yes, actually a pain in the lumbar spine in that part.
Okay. Thank you, Belen. I'm so sorry.
No, it's
Let's
fine.
continue. Let's continue then. Then we can say, put your hand down or put out your tongue. Okay, it's another instruction that we can use. Maybe, I don't know, if you can give some examples. I watch Vania here. Maybe you can give us some examples, Vania? Uh-oh.
Yes, Miss. We use um this verb when we mm, we evaluate the swallow in the mouth,
Yeah, the swallow.
and we we say put out your tongue. Yes. Put your head down when we evaluate the uh, neck and movements of the neck.
Okay, thank you, Vania. Then we have raise your leg. And it's something a little bit like this one, right? Keep your knee straight. Maybe raise your leg and keep your knee straight. And it was what Belen says. The sign of laguet, or what was it? Belen, if you can help me.
La segue.
La segue. Oh my God. Okay, thank you. Thank you very much. Then we have roll onto your back or roll onto your front. and roll over and then roll up your sleeve. Okay, where we can find these instructions and where we can use these instructions?
I saw these movements in people with labyrinthitis. Labyrinthitis, I don't know how to say it.
Yeah, that's
Yes, it's because the theory and that things that the most of the doctors say that we have crystals in our ears. So we got this sickness, or yes, it's a sickness, when those crystals are out of the canal that we have. So they do movements that are really strong, like lay down and roll over to another part and that things to make those crystals go back to the canals.
That's interesting. I never heard about that. Okay, that's a good example. I don't know if you have any questions till here about words you didn't understand. We have here roll up your sleeve, and we have here the graphic, right? The sleeve is manga. Okay, everything is clear?
Yes, Miss.
Yes, Miss.
Okay. Vanea, did you have any doubt?
No, Miss.
Perfect. We continue then. Then we have sit, like here, or another instruction, like sit up, right? Like here. Maybe it's more usually than and we know. We can use with every single patient. Then we have slide your hand down your side. I don't know if you have any example about this instruction. For what kind of examination? You can suggest this.
I saw, sorry, from scoliosis.
Okay.
It's the same when
It
actually they.
I don't know, but maybe it hurts.
No, it don't hurts, but you can see the how can I say it, the range of the spine and which one is more pronunciate. So we can see the same when we tell the patient to bend down. Is the two movements that a doctor makes you do.
Okay, that's a good example then. And we have slip off your coat. This one, it seems to be so interesting to me. I don't know what happens with you. What do you think? Or in what kind of examination you instruct this to the patient? Maybe to know if the patient is understanding the instruction. I don't know. What do you I'm so sorry. My internet is not working very well. Okay. I was saying, I don't know if you heard about this kind of instruction sometime, or do you think it's just like a manner to say, welcome to your patient, please sleep off your coat? What do you think?
Maybe when we want to take the pressure, the blood pressure, we can ask the patient to sleep off their cot. Or maybe in nursery, they ask that because they want to take blood or that things.
Okay, very good. Thank you, Belen. Then we have stand straight, like when the radiologist is gonna take a plate, right? Then stand up or sit down. Okay, those are the most common ones. Then we have let your wrist go floppy. Do you understand this one? Floppy.
What's the meaning for floppy?
When you when you are not putting your wrist so hard, and you can make move like everywhere. Do you understand the meaning?
It could be like relajado or suelto.
Yeah, that's the meaning. In which kind of examinations do you usually use this?
Maybe the traumatologist, when you had a your wrist with, I don't know, with tendinitis or that things.
Okay. He asked to
evaluate the
let
joints.
your wrist. Sorry, Vania.
To evaluate the joints.
Okay, that's a good example. It's like flexible. Okay, it can be a synonym. Okay, that's good. Then we're like on the bed couch, lie down. Do you understand these expressions?
Yes, Miss.
Okay. What about Ale or Vanya?
Yes, Miss.
Yes, sometimes.
Okay, perfect. Then we have look straight ahead, like this, or look at something, like in this case. Then we have open your mouth and point to the finger that moves. This is very interesting. What kind of examination can be used, for example, in this case?
A neurologic examination.
Okay, we had one of them similar, right? Or what? Follow my fingertip with your eyes. Okay, this one is similar to this one. Point to the finger that moves. Both can be used in neurological examinations?
Yes, Miss.
Okay. Then we have pull as hard as you can. And in this one, I don't know, we have here to push as hard as you can. I don't know in which kind of examinations you can use these instructions.
To
The same.
evaluate the mass of force.
Okay. What else? Someone wanted to talk? Okay. Then we have take off your top things. Maybe in this case to make an electrocardiogram can be one of the examinations. And what else? Or am I wrong? You have to tell me if am I wrong. Girls, we're here together. Do you listen to me?
We listen, Miss.
Okay. Another example where you can use take off your top things, maybe for examination lungs. And
We don't ask to take their top things when we do that. It's in a peculiar exams.
okay. I have an electrocardiogram a few months ago, and they told me to take off my my top things. It was so weird, but I did it. That's why I told
No,
you.
yes, in a ECG, yes, but when we
Okay.
want to listen the lungs, no, we don't ask that.
Oh, okay. That's good. I want you to tell me, okay? Remember, I'm a dentist. I want to know what is the procedure. Okay, then we have tilt your head back. Do you understand the word tilt with this graphic?
Yes, yes.
Okay, can you explain to us, or maybe say it in Spanish, Belén?
Poner la cabeza hacia atrás o echar
Yeah,
la cabeza.
it's more like inclinar, but it's almost the same. Okay, tilt, inclinar. Then we have touch your shoulder with your chin. In which kind of examinations you ask to do that?
I don't know, Miss.
Vania, do you have any idea?
Yes, to explore the cervical spine.
Okay. Okay, thank you. We have turned your head to the left and to turn on your side. Okay, I think it's almost the same, right? And other instructions, it might be relax, show me what movements you can manage, and tell me if it hurts. I don't know if you want to add some other instruction that you frequently use in your consultation. Maybe it's not here, or you are agree with every single one of these. Maybe we are missing something.
Stop your breath when we examine the heart sound
Okay,
for a little time.
okay, Vania, thank you. That's good. Anyone else want to add something?
No, miss, it's fine.
It's fine, Miss.
Okay, let's continue then. We're gonna play a little bit. I want you to describe the movements in the picture. Since we already saw most of them, I want you to tell me. I'm not gonna say Vania or Belen or Ale. I want you to tell me, but I want you to participate, okay? Try to describe. Maybe for number one, what you can say.
Open your arms.
Okay. Another one. It can be one option. Maybe Vania or Ale. No?
Separate your arms to the trunk or extending
Okay.
your arms.
Okay, it's another way to say it. Maybe you can say to flex your arms up and down. It can be another way to say it, just to make your patient understand the instructions, okay? Ale, if you want to participate, I told you, you have to tell me, okay? Don't keep your ideas. Okay,
Yes, Miss.
okay. For number two, what kind of instruction you will say?
Put your hands in your neck.
Okay, but this is a little bit up than the neck. So remember, what's the name of that part of the body?
The head or the occipital part.
Yeah, but how can you tell your patient?
That you flexion your arms behind your head.
Okay, it can be one, but that part is called nape. Remember? La nuca. Don't forget about that. You have to use easy words to explain to your patients, and that can be a good one. Behind your head, right? Or upper your neck. It can be another one. Then number three.
Put your hands behind your back, maybe.
Okay. Put your hands together behind your back. It can be. That's good. Another way to say it. Maybe cross your fingers or cross your hands behind your back. It can be another one. Okay, for number 4.
Raise your arms.
Yeah. Okay. I think it's the more common one, right? For number 5. We already seen that. Remember the word?
Tilt
Right.
your neck and pull and down.
That's right, Fanny.
Okay.
Tilt your neck back and forward, or to the front side and behind. That's good. Don't forget about that word, tilt. And then number 6. Someone?
Maybe bend your neck left and right.
Okay. Or we can use tilt, right? Tilt to the right side and or to the left side. Okay, number 7.
Turn your hip to the left and the right side.
Yeah. Okay, that's good. Then we have number 8. What we can say for number 8?
Extend your body forward or
Forward is the front side. Backwards.
upwards. Yes, yes.
Backwards. But you can use tilt. Tilt your body backwards. That's good, Ben. Okay, number 9.
Bend your body forward.
Okay, but that's good, Ale, but it's more specific, right? He's touching his finger toes without flexing his knees. Okay, it's a very specific position.
Yes, miss, thanks.
Okay, number 10. What is he doing?
Turn your
Anybody?
foot to the lateral side.
Okay. Okay, that's good. And then to the to the, how do you say, medial part, maybe. How do you say in planes when something is in the middle? There is a specific word. I forgot right now.
Medial?
Yeah, medial, I think it is, but I don't know. I forgot. Okay. Okay, that's a good thing. But maybe it's expressing movement, right? You can move your toe to the left side and to the right side. Then 11.
Flex your leg.
Yeah, it can be one. Another one. Ale, you can use the word you like, bend. Bend your knee. It can be another way to say it. Okay. Number 12. Someone?
Maybe flex your body to the right side or for the left side.
Yeah, it's a good way to say it. And 13.
It's also flex your foot or extend your foot.
Yeah, or flex your ankles, right? That's another way to say it. Okay, very good. Then we have the mental state examination. We're gonna see here some definitions for an expression. Okay, the declusion is a firmly held belief which is wrong but not open to argument. For example, a deluded patient may not accept that this psychiatrist is in fact a psychiatrist. Okay, that is a declusion. Dementia is significant mental deterioration due to physical changes in the brain. Disorientation is mental confusion about time, place, or identity. Hallucinations are apparently normal perceptions which happen without the appropriate stimulus. Any of the senses can be involved, but especially vision and hearing. Then we have illusions, are misinterpretations of real stimuli. And obsessional, that are symptoms, are stereotyped ideas or impulses which the patient cannot resist. They include obsessional thoughts and obsessional rituals. Okay, maybe you are so, I don't know, maybe you work with this kind of examination on your consultations. Every time you have a patient that you can maybe think is suffering from some neurological problem. Am I right? Or you don't usually use these kind of words or definitions?
It's right, Miss. We use that.
Okay, Do you have any questions here or everything is clear?
Everything is clear, Miss.
It's okay, Miss.
Yes, Miss.
Okay. Okay, that's perfect. Then we're gonna finish here. And I wanna know, please, who is going to be first tomorrow for a speaking class? Anyone?
I'll be
Miss.
first.
Uh,
Sorry, Bunny.
Who was, oh, Vania. Oh, Ale, who's going to be first? Okay, Vania?
no, Ale, I'm going to second.
Okay. Ale, you're gonna be the first one then. And Vania, you're gonna be the second one. Belen, are you okay with the third one or you're gonna be the last one?
The third one is good.
Okay. Okay, I will send to you my questionnaire, please. Fill it for me. Thank you, ladies. See you tomorrow at your times, okay?
Okay, bye, Miss.